when we just got the bill for the hospital and I saw $170,000, I thought, whoa.
She passed away a year ago, the 25th of April. And I've still got $38,000 worth of medical bills that I'm still trying to work on.
I don't know. I just pay them when I can pay them. Phone rings, I don't answer it.
The cost of medical care today is an enormous burden for people already struggling with cancer. People like Maria and Paula da Costa.
When I got my lump, it was small and then it would grow up and then it would go small again. So I really thought it was like an irritation or inflammation of some sort. It didn't make any sense. Once it stayed steady, that's when I started concerned, and that's when I was going to go have a check when she called. Well, it was just a phone call saying, Mom, they diagnosed me with cancer.
Oh, I had gone home for Christmas in December of whatever the year before last was. And I was fine. And I felt a little lump, but I figured my age, it was nothing. I kept growing and growing and growing. Until finally in July, I couldn't take it anymore, and I went to the emergency room.
Within a month, both mother and daughter were diagnosed with breast cancer. During treatment, they've been staying at an American Cancer Society Hope Lodge. That's not costing them a penny. But how are they going to pay tens of thousands of dollars in medical bills?
I had no insurance. And when it was offered to me, I would have had to pay half of it, but I wasn't making enough to to have had rent, food, and insurance. So I had to wait. And waited, and I waited.
And I didn't have my medical insurance because 8 months prior my business went down and I let my insurance go because I've never used it before. It is very scary. It is very scary because what do you do if you don't have the means?
It's an all too common story and an embarrassing story to arguably the richest nation in the world. The key here is that we want a healthcare system that protects people from getting cancer and helps people get well from cancer, and everybody's for that.
Dan Broderick knows the value of medical insurance, even though he's never been able to afford it. He had to watch his wife, Sharon, slip away, perhaps unnecessarily. And Dan believes it was because they had no health insurance.
Tried going to a hospital sometime, and they said, "Do you have insurance?" "No." They put you on the back burner. "Well, we'll get to you when we can." I've seen it done. I've had it done. It's not a fun situation.
But the worst experience Dan had to endure came when he called a private cancer treatment center asking for help.
A private hospital, yes. Major cancer, private hospital. And they say, "Do you have insurance?" "No, we don't have insurance." "Well, our policy is it costs you $125,000 cash up front just to start." I said, "Well, what bank do you want me to rob?" She says, "What do you mean?" I says, "I don't have that kind of money." All of a sudden, there's a pause on the phone. She says, "Well, I guess she's just going to have to die, ain't she?" And hung up. What I'm saying is, everybody should have that equal chance. That's what I'm after, an equal chance. And I pray that nobody ever has to go through what we went through.
Well, those kinds of stories shouldn't be happening, but they're all too frequent. There are tests, screening tests that cost $700. People say that's a lot of money. So let's just not pay for it. Let's just not have it. Then the person presents with advanced colon cancer and it costs $200,000.
Millions of Americans have health insurance, but can it withstand a catastrophic illness? Anna Nunez's husband is a longtime postal worker, so they have excellent medical coverage. Or so they thought, until Anna began her battle with breast cancer.
Well, I mean, most Americans who are living, I think, paycheck to paycheck, something like this, we just don't have extra money to get sick, majorly sick, like, like this.
This is the house Anna and her husband bought 15 years ago. The house their daughters were born in. The house they lost to foreclosure. Today, they're renting a small apartment.
We got behind on our mortgage, got behind on bills, and then 30 days turned into 60 days, and 60 days turned into 90 days, and before you know it, we were so far behind that we didn't have the money to catch up. After all that we've been through, it's just gotten to the point where it's just money. I don't really care who I owe or what I owe anymore. I just want to be me. So I'm getting what I need to be me. Again. They can't take anything more from me.
Healthcare reform is certainly a political issue, but it is not a partisan issue. We don't believe that there is one answer or that we have the answer. We believe that that is to be determined by the policymakers, but we believe strongly that fighting for your life with cancer is one thing, because you often don't have a choice. But having to fight for the care you need too is unacceptable in a society like ours.